So the animal bite patient presented in GP and having the history of cat bite. And after cat bite, there will be the redness, swelling, and pain on the right hand, and the status of vaccination is unknown. And the patient has not received any medical health abroad, but rinsed the wound briefly with water, and there was no fever, discharge, or systemic symptom, but mild throbbing pain was there. And unsure about the tetanus vaccination as well. So key questions: any fever, chills, or spreading redness? So no redness, no discharge, no spreading redness, no abscess formation, and no numbness, and no difficulty moving fingers, that's normal. And was the cat behaving strangely or foaming? So unsure of the cat. Was the cat behaving strangely or foaming? And any chronic disease? Have you had diabetes, immunosuppression? No. And ask about the past medical illness. None. No allergy, no family history, and recently returned from Turkey, and office worker. Patient is office worker. And non-smoker, moderate alcohol drinking, generally healthy and fully mobile. And then cover the eyes, think the wound is infected, worried about rabies and tetanus, and wants antibiotics, and reassurance about the next step. So on examination, finding small puncture wound over the right dorsum of the hand, mild erythema and tenderness, no abscess. So there is redness and there is tenderness as well. Pain is there, no abscess, fluctuance, or lymphangitis. And full range of motion is present, intact sensation, so no neurological loss, no systemic signs, afebrile and stable observations. And investigation, usually clinical diagnosis, and the swab is taken if prolonged discharge is there but there is no discharge, or if there is no non-healing wound, then take the swab. And consider the baselines, full blood count, and CRP. If infection is suspected, if rabies is high risk, contact the UKHSA rabies and immunoglobulin services. And infected cat wound is the diagnosis. Actually, the diagnosis in this case is the infected cat wound. Risk of bacteria infection, likely the Pasteurella multocida is the organism, and the potential rabies exposure due to stray animal bite abroad. So cat bites often cause the infection because of bacteria in the animal's mouth. Since this was stray cat abroad, we will treat the wound to prevent the infection and discuss the rabies and tetanus protection. So in the management, what patient can do: keep the wound clean and dry, and wash the wound with warm water and soap twice daily, and avoid covering tightly. Use light sterile dressing, and monitor for any redness, swelling, pus, or fever. And what we can offer: thorough irrigation and cleaning. We will do the irrigation and cleaning with the under aseptic conditions. Don't suture. We will not suture the high risk wounds, and especially on the hand and cat bites and puncture wounds, don't suture. And we will give you antibiotic Coamoxiclav 625 mg 3 times a day for 7 days. So here for the 7 days, and also the treatment for the cellulitis for 7 days, there was the flucloxacillin that was given 4 times a day and 7 days. Or if allergic to penicillin, then we have given the doxycycline 100 mg twice daily for 7 days in cellulitis. But here is the Coamoxiclav 625 mg thrice daily and for 7 days. I mean, if penicillin allergic, then same, but doxycycline combined with metronidazole, and metronidazole will be given thrice daily, and doxycycline BD twice daily for 7 days. And tetanus booster, if not up to date, then if have not received the tetanus, then tetanus booster will be given. And rabies post exposure prophylaxis. For the rabies post exposure prophylaxis, contact the UKHSA, and rabies also for the RIAS for the advice, likely indicated due to stray animal bite abroad. Yes, here was the UKHSA and rabies and immunoglobulin services. So then provide the information leaflet and document wound appearance, and return immediately if the fever, worsening, redness, or swelling develops. Seek urgent care if confusion, agitation, neurological symptoms develop, and report any animal contact during the future. Travel to medical services promptly.